us virtually, we have Dr. Natalia Bear, and she is the Technical Advisor for Maternal and Child Health in the Ministry of Health and Wellness. Good morning, Dr. Bear.
Good morning, Ms. Martinez, and thanks for the invitation.
Good morning, Doc. So we have been having this conversation of health and wellness, our success as a country in terms of the way we have been handling the HIV matter, particularly in the aspect of transmission from mother to child. Can you walk us through the operational process that has been taking place over the better part of a year for us to have been able to successfully complete this mission as a country?
Yes, well, thanks for the opportunity. Yes, the elimination of mother-to-child transmission of HIV and syphilis, our program started in the year 2000. And we started as a technical cooperation among countries between the Bahamas and Belize. And this was sponsored by PAHO. So this allowed us to establish the program within the Maternal and Child Health Program. 10 years after, in 2010, Belize did another exchange, this time with Suriname. So we learned from the Bahamas, and then Suriname joined us to learn from our experience. So we had two technical cooperations among countries, supported by the Pan American Health Organization. We started off with 2 districts, and 1 year after introducing it was called PMTCT then, Prevention of Mother-to-Child Transmission of HIV and Syphilis. 1 year after starting it was rolled out countrywide. So it's one more of the package of services that are offered through the health system. The Maternal and Child Health program is the one who have the greatest workload, but every healthcare worker have a responsibility to play in eliminating the vertical transmission from mother to child of HIV and syphilis. So what we do is every woman that comes for prenatal care, be it public sector, private sector, or NGO, like the Belize Family Life Association, then the counseling will include screening for HIV and syphilis, and then we will counsel the woman on the importance of, if she were to be positive, to receive the treatment, adhere to the treatment, that the science have proven that if a woman HIV positive get pregnant or get infected with HIV during pregnancy, if she have access to treatment and adhere to treatment, the transmission rate is nil. So we have had good acceptance by pregnant women to get tested, and good acceptance for receiving the treatment. We do have some cases that are kind of difficult because of the social determinants of health outside of their control and outside of our control. But we manage to provide follow-up and assist as much as we can for women to have access to treatment and adhere to treatment.
So this is...
So what we do is we do 3 screening. At first, contact with the pregnant woman. Then in the 3rd trimester, we do next screening. And then we screen when the woman is admitted for delivery at the hospital. And we screen for both HIV and syphilis.
Okay.
So that is what we have so
Dr.
far.
Bear, can I jump in quickly? So this is a milestone achievement for Belize in terms of healthcare and in terms of being able to move as a country towards meeting this particular goal, if I could use that. what can be done going forward to maintain the elimination of HIV transmission and of course syphilis transmission mother to child? What can we do or continue to do as individuals to ensure that we remain at nil, so to speak?
Okay, thanks for the question. And yes, countries have been moving towards elimination of the transmission. And in this case, one would think elimination is zero. But in this case, the target is to reach less than 2% in the case of HIV. And in the case of congenital syphilis, is less than 0.5% per thousand live births. Okay. It has been a great gain, especially for the Caribbean countries. To date, we have 19 countries certified as eliminating the transmission from mother to child, HIV and syphilis. And out of these, 11 are from the Caribbean sub-region. So the Caribbean sub-region have 58% of those 19 countries worldwide certified eliminating the vertical transmission of HIV and syphilis. What needs to be done is to continue to strengthen the services that we're providing in all sectors. This cannot be a gain, a win from one institution. It entails having the family playing an active role, getting prenatal care early, getting screened during pregnancy and before delivering, and to access treatment. Treatment is require no out-of-pocket payment from pregnant women. I don't like to say free because somebody have to pay for it, no? But the patients don't need to spend any monies to access the treatment. Right. And the public health nurses and the rural health nurses, doctors and other nurses countrywide help us to follow up on these patients. So if we need to go to the home 3-4 times to provide support, we do that. So that is one of the role of the health system, to ensure we do those home visits as needed. Otherwise, we would not achieve the goal. So it's a very good milestones for our countries. I guess you all are aware that we had our certification ceremony on the 7th of May. It was done in Jamaica, because 3 countries were certified then: Jamaica, Belize, and St. Vincent and the Grenadines. So we are very proud of this achievement because it's the result of the collaboration between families, the different health sectors, and healthcare workers countrywide.
Doc, let me segue a little bit on the same topic, but just a different question here. When we're talking about continuation of the program and so forth, we had just taken out a story about the shortages of nurses and training persons in these various programs. How is the ministry handling this shortage and, of course, the continuation of this program whilst training other persons in the facility?
Well, the ministry coordinates different training for different category of nurses, and that is an ongoing process. We know that in developed countries usually come into countries like ours and do interviews, and our nurses are well trained, so a lot of them get accepted to work abroad. And that's a phenomenon that is occurring worldwide. The shortage of nursing is huge. So for us, it means that the personnel that is working currently, private, public, and NGO, have to double the efforts. But within the different programs that the Ministry of Health has, let's say from the Maternal and Child Health Unit, We have number one is the vaccination, and number two is the elimination of the mother-to-child transmission of HIV and syphilis. So these are activities that we prioritize, and it is not affected because of shortage of staff. I think we have proven with the vaccination that we are increasing after the drop that we experienced with COVID-19 during the period of COVID-19, but we are going the extra mile, working on weekends. The nurses go to workplaces to get persons vaccinated with the routine vaccines. They go to public places to try and get the children up to date. We have measles now. Several countries have outbreak of measles. That's the next campaign that we need to focus on. But shortage of nursing personnel and medical personnel is worldwide. Countries have to go the extra mile to ensure that these basic public health interventions are done.
I wanted to continue this conversation. We were talking about us as citizens being responsible to ensure that it stays at zero. As a new mom, right, if I just found out I'm pregnant, what would be the steps that I would take? Perhaps I'm not HIV, I'm not syphilis, I don't have syphilis, but I want to undergo an entire treatment, but an entire screening and an entire procedure and process to ensure that my baby's health is up to par. What do I need to do?
We highly recommend every woman, once she missed 2 periods and she consider that she may be pregnant, or even before, if she consider that she's pregnant, to seek medical care. A pregnancy test will be done, and upon the diagnosis of the pregnancy, then she will be offered a battery of tests, including HIV and syphilis. This is now a routine test that is done, and precisely to prevent the transmission to the child. In other words, no child should born HIV positive or affected by syphilis if the mom gets screened early, diagnosed early, and adhere to the treatment. So it's one of the responsibility of being a parent, no? We take care of the pregnancy, we have a safe delivery, and we take care of ourselves, the mom and the baby, during the postnatal period, the first 42 days of life, and thereafter just follow the recommendations from the medical and nursing personnel.
Dr. Bear, allow me to depart from the mother-to-child aspect of transmission of syphilis momentarily, just to get your take on the issue of syphilis on a whole, because I don't know that we talk about it as much as we talk about any other sexually transmitted diseases. Where are we as a country in terms of dealing with this particular issue?
Well, the syphilis is usually done, the testing is done on demand. Not only in Belize, but many countries, there have been an increase of sexually transmitted infections. And for example, in our country report, we presented data for 4 years, 2019 up to 2022. And our rate at the end of that period was 0.17 cases of congenital syphilis per 100,000 live births. But we are using a surveillance definition. So we had a total of 4 kids that were positive, but 4 kids that we rule out as congenital syphilis. They did not have no signs and symptoms, and they did not even tested for a positive for syphilis. But why do we call them congenital syphilis? Because for whatever reason, the mom was diagnosed during pregnancy, and the criteria is that she needs to get treated before, at least 30 days before delivery, before that baby born. So in a few cases, we did not meet that criteria. So we end up with a rate of 0.17 per 1,000 live births. And the target is less than 0.5. So we were far away from way below the target. But it just shows, that we need to push the system a bit more. And in case of HIV, we would be much more successful if we were to work on we have this 4 prongs for elimination of the mother-to-child transmission of HIV. The first one is reducing the number of persons, in this case women, that are HIV positive. The second prong is, okay, she's positive now, so let's reduce the number of pregnancies that are unwanted or unplanned among women who are HIV positive. If the woman gets positive, then offer her the full range of services: screening, diagnosis, treatment, and follow-up. And then, after delivery, ensure that they continue receiving services.
So this is a testament really to the way that we have been handling the 2 viruses that are in country. And I guess it's just a follow-up from Asani's question as to, do we have any numbers or percentages as to where we are in terms of reducing HIV in this country?
We are not doing too bad as a country. I think we are below the 2% transmission rate countrywide, for all ages. And for pregnant women, way below the 2% also. Because the validation process for elimination, what they really look at is failure of the health system. So if we have a positive case, then they would dissect that case. And if there is evidence that the system went beyond and extra miles to ensure that this baby was negative, but the baby at the end is positive, then those cases are waived. Because, for example, if we receive a woman, no prenatal care, show up to the hospital, because we do routine testing before delivery, she turned out to be positive for the first time. So, no prenatal care, no diagnosis, no access to treatment. There is no way the system should be responsible for that case.
Right.
It's an effort from the community, from the patients, and the health system. But when pieces like this are missing, because women have a choice. I mean, if they don't like the services the ministry provide, the government provides, they have the private sector.
Yeah.
And if they don't like services in private sector, they have the NGO. So there are options.
Agreed.
But when the prenatal care is absent, I would say by choice, then there is no way the program could have helped preventing that transmission to the baby. Although the science, you can prevent it 100%, but you have to come early, you have to receive treatment, you have to adhere to the treatment.
Dr. Bear, as we wrap up our segment this morning, final words as to the ministry's movement forward with this particular program.
Yes, we were certified on the 1st of September 2023, although the ceremony was delayed up to May 7. It's a huge achievement for the country, and we urge pregnant women, as soon as they consider that they may be pregnant, to access services, prenatal care. It could be at the government facilities, private sector, or NGO, and receive the services should in case they would turn out to be positive. And the ministry, we collaborate with private sector, and if needed, if we need to go to your home 10 times to help you, we will do it. We have been doing that, and we will continue doing it.
Thank you so much, Doc, for zooming by and talking to us about this amazing achievement and milestone for Belize. Of course, we'll be continuing to be updated with the program and other programs within the Ministry of Health and Wellness. Thank you so much for joining us this morning.
Thanks, Ms. Martinez.
All right, with that, we're going to take another quick break. And when we come back, our friends from Patlight are here, and they're here to talk to us about their upcoming Teachers Conference. Don't go away.